Fibroids are common benign growths of the uterus. They actually start from a single muscle cell in the uterine wall, and then they grow. And they can cause symptoms either by affecting the lining of the womb, in which case they can cause heavy periods with anaemia and debilitation, or they can cause symptoms by virtue of the fact that the fibroids grow and get larger and press on adjacent organs, such as the bladder, causing frequency of urination, the colon, causing constipation, or they can distend the abdomen, causing an unsightly lump in the abdomen, and generally cause a sensation of bloating. Sometimes they can press on nerves, spinal nerves, and cause sciatica. Today we're going to talk about fibroid embolization. This is a minimally invasive, non-surgical treatment for fibroids. It replaces the traditional treatment for fibroids, which is hysterectomy in many cases. Now, compared to hysterectomy, fibroid embolization has a much lower complication rate and a much shorter convalescence period. The same applies to comparison with an operation called myomectomy, which is performed in patients who wish to preserve their fertility, where the surgeon attempts to cut out fibroids from the uterus. Again, the complication rate of fibroid embolization is much less, and the convalescence period much shorter.
My periods were always heavy and always painful, but I just took that as part of my lot. The trips to the corner shop, and just how I had to time my getting out there and making sure I got back in time. Toward the end of 2006, I got seriously ill, and I got myself off to the local hospital, and my blood count was dangerously low. The point that I realised that there are other alternatives to hysterectomy was earlier this year, when I started to research. There's quite serious research on the internet. And the reason I was driven to do that was because I realised that I really didn't want a hysterectomy, because leading up to this point I had been hospitalised a total of 3 times, rushed into hospital for emergency blood transfusion. So I knew that this couldn't carry on, and the doctors were getting quite fed up with me, which I can understand. And effectively it was a case of they kept scheduling hysterectomy dates, and I kept saying, no, I can't go ahead and do these because at the time it'll take me to recover. And I finally came across the embolization procedure. I was lucky enough to get a slot quite quickly, and I was really very glad of it. And because I had private insurance, I was able to have it done at the London clinic in Marylebone. And that was just literally one night in the hospital. The whole experience was fantastic.
Qualifying as a doctor at the Middlesex Hospital in 1970, Dr. Walker trained in radiology at the Cruter Hospital in Cape Town and carried out his first embolization for gastrointestinal hemorrhage in 1976. Since that time, he has published numerous articles and chapters on interventional radiology, interventional and diagnostic gynecology, and fibroid embolization, details of which can be seen at www.fibroids.co.uk. Dr. Walker is Lead Gynaecological Cancer Radiologist at the Royal Surrey County Hospital, which is a national referral centre for gynecological cancer, and has a Silver Merit Award from the NHS. He has personally carried out more than 2,000 fibroid embolizations as part of the ongoing Royal Surrey and London Clinic trial.
This is the imaging suite at the London Clinic where we perform these fibroid embolization procedures. This is the table on which the patient lies, and here's the X-ray TV screen which helps me to perform the procedure. But before the patient gets to this point, the patient's had a consultation with the interventional radiologist and also a magnetic resonance imaging scan to show the fibroids in great detail. So this is a magnetic resonance imaging scan of the patient's pelvis. And what we've done is this is looking at the pelvis sideways on, like that. So this is the backbone, this is the front of the tummy, this is the muscle of the front of the tummy, this actually is the bladder, and this is the area of the uterus. And you can see this black area here, that is one of the fibroids. That's another fibroid there. You can see that's another fibroid there. And there's another fibroid there, and several other fibroids in the uterus. When we inject the contrast medium into the main blood vessel in the tummy, the aorta, this is what you see. You can see the contrast medium coming down through the arteries in the pelvis and giving me a road map of the vessels in the pelvis so that I can see the vessels supplying the uterus and the fibroids. And this actually shows the two arteries supplying the uterus coming in from either side. Now we're going to cut to our graphic, which shows the catheter passing up the right pelvic arteries over the top of the bifurcation of the aorta and down into the left pelvic arteries, and then passing into the left uterine artery. And when the catheter is placed in position in the left uterine artery, we then inject tiny particles of PVA, polyvinyl alcohol. These pass to the fibroids only, leaving the normal uterine tissue unaffected, and the fibroids are deprived of their blood supply and they are killed. There are various types of fibroid which are classified according to their position. If they lie within the wall of the uterus, they're called intramural. If they protrude into the cavity of the uterus and affect the lining of the womb, they're called submucous or intracavitary fibroids. If they stick on the outside of the uterus, they're called subserous. And if they're actually on a little stalk, they're called pedunculated. The great merit of fibroid embolization is that it kills all the fibroids at one hit. The recurrence rate after this procedure is extremely small. Most patients with fibroids are suitable for the procedure, regardless of whether they have one fibroid or numerous fibroids, and regardless of the position of the fibroids in relation to the uterus. After the procedure, patients do get pain, which we control with a cocktail of drugs. It lasts about 10 to 12 hours. And the convalescence period after fibroid embolization is about 2 weeks. Most of our patients are back at work in the 3rd week.
So looking at the way this has changed my life, it's just completely turned it 180 degrees around, where I didn't really have a life. I was literally existing. I was literally going from one month to the other, just effectively. It was just a laborious process being alive. And then looking back a few months later, after having had this procedure, I'm healthy, my blood counts is fine, I'm out and about, I'm looking for work. It's completely transformed my life.
We've tried to give you a brief overview of fibroid embolization. There's a lot more detail on the subject on our website, fibroids.co.uk. Fibroid embolization is approved by the National Institute for Clinical Excellence for routine use. Finally, thank you for watching.